Welcome into News Channel 11 at 5:30. I'm Josh Smith. Sarah Diamond will rejoin us in just a moment. First, today, Ballad Health said they passed a milestone in the COVID-19 pandemic. The number of patients being treated in their hospitals for COVID-19 topped 200 for the first time since the start of the pandemic back in March. Today, with 202 patients now with confirmed cases, Ballad said 44 patients are in intensive care. 24 have been placed on ventilators. Ballad said they had 40 deaths now related to COVID-19 over the past 7 days. So that's 40 deaths in a week. Joining us live via Skype as she does on Mondays, and we're grateful for it. Ballad Health Chief Infection Prevention Officer Jamie Swift. Jamie, thank you for being with us. We just got you on the line. Can you hear me okay?
Yes, I can.
Okay, great. Thank you very much. Let's, we put these numbers out, and I know 200 was kind of this sort of emotional threshold in a way it seemed for all of us. If we got to that point, gee whiz, here we are. But why is that number, why are these numbers a real issue for the health system, 200?
It's really about resources. So we're constantly, trying to make sure that we have beds and staff available to care for all of our patients. And so when you get that many extra patients on top of what we typically run in our normal services, there's not unlimited resources. So as we've had to make those decisions to start cutting back on certain things to make sure we can care for all of the COVID patients right now.
Jamie, we tracked those beds available. I think we said today you have 23 COVID-19 beds available. And honestly, I don't know really for sure that I know what that means. These are in areas of the hospital where you have the resources and the people that have the PPE. Is that essentially it?
It is. It's beds and staff, and so making sure that we have nurses who could staff those beds immediately. It's not to say that at 23 patients we would immediately just have to shut down. It's at that point then we have to, start looking at other things that we have to do. And so, that number changes daily. It changes by shift each day. It really depends upon the staff that are available to staff those beds as they come in. We'll continually be doing things to change that around to meet our capacity. It just gives us an idea of how much leeway we've got for the day.
That was a pretty hard pill to swallow, hearing that number just a moment ago. 40 deaths related to COVID-19 in your hospitals in the past week. Can you give us an idea, privacy being respected, but who are we talking about? Is this primarily an older, medically fragile group of people that passed away? Are you seeing any shift in that demographic as you're tracking it?
As we've talked about, it varies. So we have certainly, had deaths 40s, 50s, 60s, 70s, 80s. And so, it really does depend. We have talked about seeing a lot more of those functional elderly admitted. So not necessarily that the people that are at home and sick and multiple comorbidities, but people that are living their life, that had they not contracted COVID would most likely still be with us. And that's, we don't want to lose sight of that.
I saw a video today posted from Sullivan County's health department where they essentially said, just over 90% are going to get this and be fine, or not even know they had it. And about 6% are going to get sick, or maybe more than that. But then it's going to be about 1% that's not going to make it through this. And I want to know, does that jibe with you? Is that kind of what you're wanting people to know? And while 1% may not seem like a lot, that could be enough to really have a huge impact on the health system. Is that a good way to keep moving forward with this breakdown at this point?
It is, and that's what we've heard nationally as well as regionally. And people can focus on 1% and think that's really small, but when you think about total population, that's a lot of deaths. And so we're doing everything we can to prevent infection and to prevent deaths. And people have to remember, certainly, even if we have people that don't die, we are starting to see people that are having long-term complications that are really struggling a month out or longer, and with some of these long-term complications. And so it's not, for some people, it's not just a minor illness that they get over. Some it will be, and certainly we are thankful for that, but we don't want that to diminish all the other illnesses.
Anecdotal story for me. I love your reaction. I heard at least 2 or 3 times over the past 24 hours people say, I was out and about over the weekend, saw tons of people, not a lot of masks, and it was very concerning to them. Are you concerned about that 2-week sort of like epidemiological, echo back of having a Halloween outing?
I am. Anytime there's a holiday, there's a chance for group gatherings, as an infection preventionist, I'm going to be concerned. You know, it's a balance of asking people to please take precautions and then trying to find a way to celebrate those events. And so, you know, based on the things that I saw, I too have that concern. I saw a lot of events that didn't have masks, and you know, ultimately that trickles down. So you know, it may be people that were out and enjoying their Halloween may not be the ones in the hospital, but it's the people that they then spread it to that, you know, that we're going to see the impact from.
Sometimes not even knowing that they spread it. And real quickly, you know, in terms of schools, are you at the point where you just wish they'd shut down? Because I know for some schools it's in and out and back and forth, and you have kids, and you're trying to deal with that, I know, in your personal life as a part of your professional life. What would you like to see, or at least what would you like to say to people who are having to make these decisions?
You know, honestly, it still comes down to a school decision in conjunction with health department and individual family decisions. I think you have to look at what are the risks in your family, what are you willing to risk versus not risk, do you have high-risk people in your household, and to have those discussions. And then, you know, we're certainly supporting our schools. We're trying to do everything we can to give them the information. I know the Department of Health is working daily with those schools, and a lot of it's about trusting our leaders to really, you know, get the information and make the right decision for each school district.
And it's day by day, it seems. So we just reported a change a moment ago. Jamie Swift, do us a favor. Give our best to your people who are there on the front lines. We know they've never probably worked harder in their professional lives than they're having to do right now. So tell them we said thank you and our best to them.
Thank you.
Sarah?